Welcome to the Ergo2go podcast, brought to you by the Back School and Ability on Demand. I'm your host, Matt Jeffs. We bring you interesting people from the world of ergonomics, on-site injury prevention, health, safety, well-being, and a whole lot more. Don't forget to subscribe below and click on the little bell in the upper right-hand corner to get the latest on the overlapping fields of ergonomics, health and safety, risk management, human resources, and healthcare right here on the Ergo2go podcast. Today's guest has been on the Ergo2go podcast, the co-founder of the Health Rosetta and the author of a new book about the opioid crisis entitled The Wake-Up Call, the Opioid Crisis Wake-Up Call. He's got a varied background, and our earlier two segments have been very in-depth. We're looking forward to summarizing in this one. It's my pleasure to welcome back to the Ergo2go podcast, author Dave Chase. Dave, welcome back to the podcast.
Well, thanks again for having me on. Looking forward to wrapping up our chat.
Yeah, this has been good stuff. Thank you for bringing us kind of the before, during, and now the solutions based. And this is where we all wanted to drive with this. In your Opioid Crisis Wake-Up Call, the book, your new book, it outlines how the crisis isn't an anomaly. It's really a byproduct of a dysfunctional system. You and I could go on for hours on this, having been from both sides and seen it firsthand, but we've covered that. Let's talk about some of the solutions. So in your book, you've talked about some different segments of the population that can help, one of them being the communities. How can communities help in this solving this problem?
Well, it's really important to recognize that this is a unique crisis in that other great public health crises, things like polio, HIV, whatever, primarily a government-led effort could solve it. This is one where certainly a government role is necessary, but it's far from sufficient. If you look at how did this, where did people get these opioids? Well, if you look at who's been impacted, overwhelmingly, it's working age people and their dependents. And so where do you get your benefits paid for if you're working age or the dependent of somebody working age? Overwhelmingly, it's your workplace. And so whether you're a private sector employer or you're a public sector leader who has a bully pulpit but also has employees, it's really on us. The cavalry is not coming from DC to fix this. It is on us to fix it. Fortunately, it is fixable. And we can talk about kind of the two dimensions. How do you address the people who are already enslaved by opioids, frankly? And then how do you prevent that addiction from ever happening to begin with, which, you'll never clean up the mess if you don't turn off the spigot. And so you need to have a balanced approach on both. And if you'd like, I can give you a couple examples.
Please.
Yeah. So in terms of addressing the people who are already addicted and or dependent on the opioids, I have a case study about Plumas County. It's in Northern California, rural area. They had the highest rate of opioid overdose deaths in the state, 4 times the state average. They got together really basically with a 3-pronged approach. The punchline is they're 2 years running with 0 opioid overdose deaths, which is impressive. And they basically made the overdose reversal drug more broadly available, naloxone. Then the kind of gold standard for helping people who are dependent or addicted to wean off is medication-assisted treatment. Previously, people had to drive 90 minutes to get access to that. Now they have folks in that community who can address it. And then 3, starting to go upstream and realizing most of the prescribing was happening in the primary care setting or the emergency department. And essentially, if you follow CDC guidelines, generally you don't have a problem. So they have an approach that I call academic detailing. Detailing is a term in the pharmaceutical industry. It's basically a fancy term for sales calls. But the idea is rather than pushing the drug, it's pushing a solution and educating people. And so that's kind of these people are already dealing with that issue. We have to address that. But we have to go upstream. If a bunch of people show up to the emergency department with symptoms of being poisoned, you'd stabilize them, but then you'd go, what's going on? Is there a salmonella outbreak, or is there something in the water? Well, that's where we go into the primary care we talked about earlier. So an organization like Rosen Hotels that has a challenging workforce, physically demanding jobs, maids, maintenance workers, things that you could expect you would have some musculoskeletal issues, which happens to be the biggest on-ramp to inappropriate opioid prescriptions. They spend 55% less per capita on health benefits, and they take that money that would have otherwise been squandered in healthcare, they actually put it into health. They pay for their employees, you can believe this, they pay for their employees' college education and their employees' kids' college education, and then they do even more stuff in the community, which we could get into, which is even more amazing.
Wow.
But then they also do the sort of things I'm sure you do all the time where, yeah, they address the acute issues when they come in, but then more importantly, they go into the workplace, teach people how to, really defend themselves in a sense against musculoskeletal issues, how to lift properly, how to exercise, all of that. So they stop those issues from coming in. And, this is just an incredible story. The focus of my TED Talk was around this organization. So there's more to that story. But when I wrote this recent book, I went back, it's like, oh, I need to ask those guys, what's their rate of opioid prescriptions? And I was hoping it would be low, but I didn't know. And so they went and looked at it. Well, it is far lower. It's like a sixth of a typical employer. Basically, it puts it at where France or Italy is, and they don't have the benefit of French and Italian food and wine. So, there you go. So they didn't have to have a specific opioid program. They had a specific program on how to, every employer says, our employees are our most important asset. Well, they actually live that. A lot of people just talk about that and really don't deliver health benefits that actually help their members. In a lot of cases, they're harming their members both physically and financially.
Astonishing. And as we talked about earlier, how we know how we evolved over the last century into an employer based reimbursement isn't the right word, but health insurance purchasing model. How can employers themselves help? You mentioned the community as you described. You mentioned Rosen as well. Are there other examples of employers? Have they maybe also can join in a little bit further?
Oh yeah, absolutely. I mean, that's really what the organization I co-founded is all about, is bringing the people together who actually want to solve the problem and actually have solved the problem. We were talking about evidence-based medicine. We talk about evidence-based health purchasing. These are the people who are not just filling conference rooms and exhibit halls with hot air. They've actually done it on a sustained basis. In the case of Rosen, they've been doing it for over 20 years. Another case study I have in there is the Pittsburgh area schools. They've been doing it 8 years. So it's not just this anomaly. And so what we do is we say, hey, these approaches, if it was in a pill, would be the biggest blockbuster drug of the century. So we're going to make it available. And if there's one thing that employers have to do, is they have to get the right benefits consultant or benefits broker. It's probably the single most underestimated role in the entire healthcare system. You could probably argue it's the most underestimated role in the entire US economy, because most employers defer the decision to their benefits broker. But unfortunately, most of the time, the benefits broker is pitching themselves as representing the buyer, but they're paid by the seller. So you have these massive conflicts of interest.
Yes.
And so what we do is we certify kind of the good guys who are actually aligned with the people who are actually spending the money. And that's kind of the tip of the spear on this movement. And so just even in the last year, we've certified 110 of these benefits consultants. That's only about 15% of the people who've applied. Represents about 4 million lives. So certainly a long ways to go, but a year, that's pretty amazing. That would be, in terms of US lives, that would be 3 Walmarts. So we're getting after it. And, we talk about the Health Rosetta dividend. I talked about how Rosen is paying for their employees' college education, their employees' kids' college education. Other companies are putting money into profit sharing or R&D or benefits or, some combination of those things. And so that's what's really inspiring to, me and to my counterparts is those solutions are there. Really, as I joke, it takes a brain and a backbone. That's the only ingredients you have, because it's change. I get it. And that's part of what we communicate is like, okay, how do you overcome what I call the preservatives, that are there to preserve the status quo? So that's kind of how we go about it.
The preservatives, what a great term. Speaking of the preservatives and their influence on the bigger picture, can we look to Washington to help in any way? Is Congress doing anything to solve this epidemic? Or has there been any thoughts or any recent legislation?
Yeah. Well, first of all, so we mentioned the preservatives. I actually coined that when I was looking at, I said, there's people who call themselves conservatives and there's people who call themselves progressives.
Right.
In Congress, I would argue 80% of them are actually preservatives. They are there paid to preserve the status quo. The healthcare industry spends more on lobbying than oil and gas, defense, and financial services combined. And so most of what you get out of DC, consequently, is about doubling down on the status quo. And so now, it's not all negative. There was legislation that came out recently. There are some good elements to that. But frankly, a lot of it is focused in on that, okay, here's what we do if people are already addicted. That's clearly important. And they did things like put sunshine, they call it sunshine, on other prescribers besides doctors. Like you can Google your doctor and see how much money that they got paid by pharmaceutical or medical device companies. That's fine. They expanded that with this legislation to other prescribers like physician's assistants and nurse practitioners. That's all fine, but that's only half the picture.
Right.
There's no sunshine on the money flow and the chain of custody of the pharmaceutical supply chain. And so if they want to actually solve that problem, you need to pull back the veil, because the money that's going between pharmaceutical companies, the distributors, the pharmacy benefit managers, the carriers, the benefits brokers, everybody's got their hand in the pie, and it's creating all kinds of perverse incentives that then the collateral damage on that is the largest public health crisis in 100 years in this country.
$3 trillion a year, I think the Dartmouth Atlas estimates, and $1 trillion of it is complete waste. $1 trillion a year, throwing it away. It's astonishing. Dave, in addition to purchasing your book about the opioid crisis, where can people learn more? Through the Health Rosetta? What are some good ways to learn through what you offer?
Yeah, through what we offer, just go to healthrosetta.org. We try to publish as much of this information as possible. And then we also list these benefits consultants that you can work with, because frankly, if you're not working with the right person, you are going to be pushing a boulder up a hill. When you work with the right person, these people are worth their weight in gold. And they're probably underpaid for what they're doing. And so you have to work with the right person. They do things like, we have a plan sponsor bill of rights. We have a code of conduct for the benefits consultants and a disclosure. How do they get paid? They need to be transparent about that. They can't be in our program if they're not supporting and adhering to those things. So there's other things that you can read about on the site to do, but if you don't start there, you're going to have a big problem.
Dave, now I understand and appreciate your utilization of value-based, and this really is value versus volume. It's exciting stuff. It's great to know that leaders like you are out there bringing this to the forefront, that there are solutions, and the solutions have a track record. Some, like you mentioned, Rosen, are decades long. So we've got something to look at, but again, imbued within this system, I'm going to steal that term, preservatives, my friend. That's the one we've been looking for. I hope we can have you come back on the podcast, because this is a deep dive. This information and material could go on and on and on. And frankly, our format right now is a little on the short side. could I trouble you to maybe think about maybe returning sometime?
Yeah. Anytime. We can do the extended dance music version if you want. So yeah, happy to chat. And, I just, in the talks I give, like a lot of adults, 80% of adults will have an acute back episode at one point. I've been fortunately quite healthy overall, but that's been my bugaboo. And I sometimes pull out this lacrosse ball and I say, the PT exercises I got, including this $3 lacrosse ball, has done more than any spinal injection or drug or anything that I got to address the issue before.
Yep.
And so that is, so undervalued in our system, is getting proper primary physical therapy into primary care and really hand in glove fit. So, real honor to speak with you and great to hear about what you're doing.
Oh, well, we've got more to discuss because you're right. I always taught my patients, our job, yours and mine, is to get me out of your life. So if you follow the things I show you, you'll come back, but you'll come back for a different issue. And that's really the return business I want. I don't want you to keep coming back for the same thing over and over again. So it's great that you're tied into the ethic of doing things right. You're absolutely right. From our first segment, that's really what's going to bring the joy back to the work for us practitioners, which, we're on the front line. If we're enjoying ourselves, so will the patient, so will everyone else. And I'm so thrilled to have a chance to talk with you, Dave.
Yeah, well, my PT enjoys seeing me on the ski slopes or on running trails or on my mountain bike much more than in the clinic. So I always appreciate that.
That's how it's supposed to be. Gosh, thank you so much. And let's do this again. Okay.
Okay. You bet. Thanks.
You've been listening and watching the Ergo2go podcast. I'm your host, Matt Jeffs, brought to you by the Back School and Ability on Demand. We bring you interesting people from the world of ergonomics, on-site injury prevention, health, safety, well-being, and a whole lot more. People like our good friend, Dave Chase. Don't forget to subscribe below and click on the little bell in the upper right-hand corner to get the latest info in the overlapping fields of ergonomics, health and safety, risk management, human resources, and healthcare right here on the Ergo2go podcast. Until next time, everybody, let's be safe, let's be smart, and let's be healthy. Let's all get to work. See you next time. Bye-bye.